Okay, hi everyone. Welcome back to the AKIDS Symposium 2022. As we wait for people to stream in, perhaps I could introduce Dr. Chong, who is here with us to talk about managing eczema in children. Dr. Chong actually graduated with an MBBS from NUS in 2004 and obtained his MRCPCH in 2010. He's a member of the Asthma and Allergy Association and a visiting consultant at Raffles Children Centre at Raffles Hospital. Dr. Chong treats all general pediatric conditions, administers childhood vaccinations, and performs developmental assessments. He has a special interest in paediatric dermatology, which includes skin conditions such as atopic dermatitis, urticaria, hemangiomas, and skin infections. Okay, so without further ado, let's have Dr. Chong introduce how to eczema in children with us. Okay. Hi, Dr. Chong.
Hello, hi. So I hope you can see and hear me clearly. Okay. Good morning. Hi. Thank you very much for inviting me. I appreciate AKIDS for giving me this opportunity to share with you about some frequently asked questions on this very common topic. It's called eczema or atopic dermatitis. So it's really not meant to be a very scientific lecture or anything like that. It's more about some useful tips and some general knowledge that you should have about eczema. So without further ado, I shall commence, okay? Okay, so first of all, what is eczema? That's a very common question. So eczema is a chronic skin condition which involves skin which is very inflamed, okay? And frequently it is very itchy, it is red, and it feels rough, okay? So this is the answer to the first FAQ. And the next question is, what are the signs of eczema? Okay, so in young children especially, so any rash that is red, itchy, and bumpy or rough would be very suggestive of eczema, okay? So it usually looks like that. You can see very rough, thickened skin on this photo on the left. And on the right, you can see red patches. They can occur anywhere on the body. Very frequently, they happen. They can occur on the joint areas as well as the face in young babies. Okay, so why does eczema happen? Okay, so if you look at this pictorial on the left, you can see normal skin. And skin is actually the largest organ in our body, and it forms the best and greatest, it forms the a very important immune system component, okay? And it contains various cells and various lipids, which together form the natural moisturizing factor. And there are also various other proteins which links all these cells and proteins together. So it forms a very good, nice barrier, okay? However, if the barrier is defective, then allergens and irritants from the external surroundings can come into contact with the internal cells and internal immune system, immune cells, okay? And this causes an inflammatory response. At the same time, there's also increased water loss, so your skin will become really dry, sometimes like a tree bark, okay? So why this happens is usually, first of all, there's some genetic predisposition. There's this gene called filaggrin gene, which could be mutated, and this results in absence of or reduction of this protein, and therefore the natural barrier is affected. So is this contagious or not? So eczema is not contagious. However, if there's a secondary bacterial infection, another patient with eczema who comes into contact with that bacteria can also get infected as well, okay? But for patients with a normal skin barrier, when it comes to the contact with normal this kind of normal bacteria that triggers eczema flares, nothing would happen. Okay, so in summary, it's not a contagious condition. Okay, so what triggers eczema flares? Okay, there are too many triggers. Okay, the most common trigger in our local population will be hot weather and sweating. All right. And in addition, there could be other external agents like grass, physical exercise, woolen materials, stress, and very importantly, dust mites. House dust mites can also cause eczema. Okay, notice that I put food only as a very low percentage. Okay. Okay, so the most common question that I have is, what food should my baby avoid? Okay, so yeah, so has it got anything to do with food in the first place? So just to let you know, there are two kinds of allergies. One is an immediate allergy, and the other kind of allergy is a delayed allergy. So immediate allergies will happen within a couple of hours after consuming a certain kind of food. So this gives rise to signs like swollen eyes, hives, okay, like the rash that you saw earlier, as well as shortness of breath. Okay, so that's called signs of anaphylaxis or immediate allergies. Okay, however, delayed allergies are the kind of allergies that only occur even 2 days after taking the food. So it can be a bit hard to pinpoint exactly which food. Okay, but for the record, very allergenic foods would include egg, milk, soy, wheat, and nuts. Okay. And we only have tests for immediate allergies, but we do not have tests for delayed allergies. Okay. So the two available tests that we have for immediate allergies will include number one, a skin prick test. Number two will be a blood test. Okay. So a skin prick test looks like gives results that look like that, and you can see wheels or hives that come like that. Okay, so this is what a skin prick test looks like. After pricking, in 20 minutes, if you see a very significant reaction, then it means that your body is actually sensitized to that material, to that agent that we are testing for. So in addition to a skin prick test, the other test would be a blood test. So a blood test can give you the kind of like level of allergy that you may have. So there are different grades, like grade level 1 to level 6. Okay, whereas the skin prick test just tells you a yes or no answer. But a skin prick test is not really painful, but of course a blood test, for a blood test, the child will have to be subjected to a blood test. Okay, so that's not very ideal in some circumstances. But more often than not, for the purpose of eczema test, allergy testing, a skin prick test is good just to explore. Okay, it suffices. Okay, so do I need to apply a moisturizer? Do I need to apply a moisturizer? That's a resounding yes. Okay, you definitely need to apply a moisturizer if you have eczema. Okay, because your skin is dry. Okay. And at what age will eczema occur? Eczema occurs at any age. Okay, you can have it as young as a baby as young as 1 year old can suffer from eczema. The first onset can also be when you are like 10 years old, 20 years old, even 30 years old. Okay, so it can occur at any age. Okay. Okay, so you can see that for many eczema patients, right, the itch can occur worse at night. And why is this so? So there could be a few reasons. Okay, so a scientific reason could be because the level of this hormone called cortisol in the body is usually lower towards the end of the day, okay, before bedtime. However, it peaks again in the morning. Okay, so when the level is low, then the itch would be more significant. So what cortisol is in fact a steroid. Okay, so as you can see, this is why steroid is actually a treatment for eczema. Okay. Okay, so what are the different stages of eczema? So in this first photo, you can see a very common photo of a baby with eczema that we see quite frequently, and you can see that this baby has it on the face. Okay, After the infantile phase, it can travel downwards and it can affect the joints. Okay, these are called the flexural areas. And then it can also spread to the rest of the limbs. Yeah, so and then when you scratch it, you can see a lot of broken skin here and there. Okay. And when you don't treat it, then the skin can become really, really thick. Yeah, that's really no good because it's very, very itchy. Okay. And frequently we will ask whether there's anyone in the family with sensitive skin or nose or asthma. We ask this because we just want to risk assess, okay, whether these other conditions may be possible in your child as well or not. When there's a family history of anybody with these conditions, there's a higher chance that their offspring can have either of these conditions as well, okay? So it does run in the family, it's kind of hereditary. Okay, so let's talk about treatment. Okay, so what is the treatment of eczema? Okay, so first part of the treatment, first of all, you need to moisturize. Okay, so there are different aspects of discussion. Okay, which is the best moisturizer that you can use? Okay, so there isn't a specific best brand, okay, which we would advocate, but the best moisturizer is the one that suits your financial ability, okay, and it needs to be the best moisturizer that you can withstand the texture of, because different moisturizers have different feel to the skin, and your child most importantly have to appreciate it, okay, and not detest it so much. And also the best moisturizer is one that maybe doesn't smell too much or too badly, okay, so that the child is comfortable. So it's very, very personal what a best moisturizer is to any one patient. How often do you apply moisturizers? Okay, so the answer would be as often as necessary so that the skin never feels dry. Okay, so you need to always have that little layer of oiliness when you run your fingers across the skin, so that your skin barrier integrity is kind of protected, and then the risk of flares will be lower, right? So in certain cases, right, you even have to apply every 2 to 3 hourly. If you don't do so, right, you would say that the moisturizer is not good, but actually it's not really because of the ineffectiveness of the moisturizer, it's the frequency of application, okay? And also the quantity is very important as well. Don't put too little. If you put too little, then obviously it wouldn't work. On the other hand, if you use too much, would there be any issue? So by and large, there's usually no side effect, okay? Of course, different patients can have different sensitivity to different components of the moisturizer. Okay, so sometimes, yes, you can have contact dermatitis or allergies after application of moisturizer, but by and large, it is very, very, they are well tolerated. Okay, so most of the time, there's no problem with applying too much, but in certain circumstances, the sweat cleanse can be occluded by moisturizer application, and therefore a lot of heat rash can be generated. So you need to watch a little bit closely, especially if your child is undergoing a wet wrap therapy, which I'll show you what it looks like later. Okay, because when there's too much occlusion, then moisturizers can occlude the sweat glands and result in a heat rash. If you just apply moisturizers, this will just be half, 50% of the treatment, okay? You need to address the other half of the problem, which is the inflammation. Therefore, reducing inflammation is super crucial. Otherwise, the eczema wouldn't get better. Okay, so to reduce inflammation in eczema, there are 2 classes of drugs. One would be topical steroids, and the other one will be topical calcineurin inhibitors. Okay, so topical steroids would be the one at the left here, and there are different brands, different strengths, and different vehicles, meaning it can be in the cream form or the ointment form. Okay, there are different levels of potency of steroids. Okay, it ranges from very mild to super potent. Okay, so it doesn't mean that all steroids are definitely harmful, and because there are different strengths, so you can actually titrate accordingly, and you can even start off with the weakest one after you discuss with your doctor. Okay. The other class of medication is called topical calcineurin inhibitors. And this does not contain steroids at all. Okay, so you can freely apply. Okay, previously there was this talk about association with cancer, but then this was completely debunked recently with very new studies and research that has shown that it's a very, very safe class of medication to give even in young children above 2 years old. So there should not be any issue. Okay. Elidel has been used in patients above 3 months as well, this particular brand. Okay. The side effect is of this group of drugs, topical calcineurin inhibitors, is that sometimes it can cause a burning sensation or broken skin, and also it's actually quite costly. Okay. Okay, let's talk a little bit about steroids since everybody's quite worried about it. I would say quite a number of people, all right? So I just want to say that steroid cream use is found to be safe and effective if used appropriately under medical supervision. As I told you, there are 3 components to its use. Number 1, you need to use the appropriate potency. Okay, if you use a steroid which is too mild, it is not going to work. Okay, on certain areas of the body. Then when it doesn't work, then you may blame the steroid cream for causing the flare when it's not the case. Okay, that's counterintuitive. Okay, it's simply because the steroid is not strong enough. Okay, so yes, there are strong steroid creams and there are also mild ones. Okay, so choosing the appropriate potency is important. Next, the area. Okay, so different areas of the body. For example, let's say if it's on the face, the neck and the joint areas, these are areas with thinner skin. Okay, so on those areas, yes, we would prefer to only use mild steroids and not strong ones. Okay, so that's one consideration as well. Which part of the body requires the steroid? Something very crucial. If you apply too little steroid cream on the affected, then obviously the steroid cream is not going to work, right? So imply enough such that you could see a tiny bit of cream on the skin. Okay, don't apply until you could barely see anything or barely feel anything. Apply till you could see something. Yeah, because frequently children are very, very active, and once they sit on sofas or lie on their beds, the cream will get smeared onto those surfaces anyway. So don't be too worried about the application. And in general, I think my advice would be to see a doctor frequently to make sure, okay, to reassure yourselves that there is no toxicity from steroid application. And it's also to let the doctor double check and make sure that you're doing things in the right way and not under applying the creams as well. Okay. Yeah, so in rare circumstances, if the creams are not used appropriately, like for example, you apply a cream that's far too potent for an area that has very thin skin, yes, it's possible that steroid creams can thin the skin, but usually that's after prolonged exposure. Okay, so it's important to use these creams under medical supervision. Okay. So how often should steroid creams be applied? Usually they are applied 2 times a day. Okay, how much steroid cream should we apply? So I'm asking this question again, okay, on behalf of everyone, because the usual answer would be a very thin layer. So some caregivers take it to the other extreme and apply so little. If you apply so little, obviously it's not going to work as well. So you should apply enough such that there should be a sufficient amount that could be visible. Okay. Yeah. So, okay, this is another very important question. So another pitfall to management of eczema is the duration of topical steroid therapy. So this thing about 5 days, 7 days, 3 days is actually fairly arbitrary. Okay, it's not like after 7 days you definitely couldn't. You definitely cannot continue with topical steroid cream any longer. There's no magical duration. Yeah. So usually you apply it until the skin is not red, not bumpy, and not itchy. So if you apply a sufficient amount with the correct frequency on the correct location with the appropriate steroid potency, by and large, after 5 to 7 days, right, this topical steroid treatment should work. Okay, so if you want me to give a duration, I would say yes, after 5 to 7 days, it should work. Okay, if it doesn't work, then you need to reassess whether you're applying too little or the potency is insufficient, or you're not even really applying anything at all. Okay, so so in terms of duration, yeah, sometimes you really need to play by ear, and different parts of the body will require a different duration, and different severity of lesions can require a different duration as well. So you can't have a blanket rule to say, oh, after 3 days you must stop, after 5 days you must stop. Okay, so it really depends on the situation. By and large, my advice would be to apply until the lesions are not red, not bumpy, and not itchy. But if there is no response after 5 to 7 days, see a doctor again to titrate and ask what's going wrong. Okay. Okay, so another important question is, do you apply steroid creams first, or do you apply the moisturizer? Okay, so there is no study to say which is superior, but some do advocate applying steroid creams first, so that the anti-inflammatory action would take effect first. Okay, but however, some people would say apply the moisturizer first, so that when you smear the moisturizer all over, you do not inadvertently smear the steroid cream over the normal parts of the skin as well. I don't think you need to be too pedantic about this or remember so much. Just make sure that you maybe leave a gap of about 5 to 15 minutes if you can. Okay, so that one layer can get absorbed first before applying the other. Okay, so don't have to remember too hard about which comes first, because there are no great studies to disprove the application of either one first. Okay. Okay, so we already talked about this before. The alternatives to steroid would be this medication called this class of medications called topical calcineurin inhibitors. Okay, so there are different strengths as well. Okay, and very recently, the Health Sciences Authority in Singapore has approved this other ointment called crisaborole. It's still not widely available yet, but it's already approved. Okay, so this is another class of medication called PDE4 inhibitor. Okay, just a very long name, but don't worry too much about it. It does help to reduce the inflammation in mild to moderate eczema. Okay, so if you're really concerned about the use of steroids, rather than leaving your child untreated and suffering from the itch and lack of sleep, do consider using these other creams as well. And this is actually licensed for children more than 3 months old. Okay, another question is, does the detergent use matter? Okay, by and large, I wouldn't say it does. Okay, so don't be too worried about using the brand of detergent that would like worsen the eczema, so on and so forth. But usually you should not matter too much. Okay, so I'm just talking about moisturizers and using anti-inflammatories to bring down the inflammation, right? Yes, there are times when, despite using topical treatment, the child's eczema doesn't get better. Okay, and as I said, even after troubleshooting, what I mentioned earlier about the potency, the amount and the frequency of application, sometimes some patients have very serious eczema, which doesn't get easily treated with topical treatment. Okay. So when this happens, it's really important to see a doctor earlier again to first of all assess whether this is indeed eczema or not. Okay, because it could be a different diagnosis which requires a different form of treatment. Okay, but if it really is eczema, then you need to move on to second line treatment. Number one, you can use something called a wet wrap therapy, and this includes wearing a little suit like that, which is skin tight but not overly tight, so it's actually rather comfortable actually, so that there's this barrier that will prevent the child from scratching his skin directly. That's one advantage. And the second advantage is that it can form an occlusive effect. Okay, so you can use a mild steroid cream together with moisturizers, and they would stay on the skin for a longer period of time, thus enhancing their efficacy. Okay, so this is one good way of helping the child overcome initial topical treatment failure. However, if that doesn't work, then you need to move on to using other forms of therapy, because indeed you do not want to be applying topical steroids for the patient for weeks and weeks, right? Yeah, so therefore another treatment would be using phototherapy. However, of course, there are pros and cons. You will need to go down to the phototherapy center in KK or NUH 2 times a week, okay? And some side effects could also include dry skin, yeah? So another method would be to use oral medications for older children to suppress your body's immune system. This will also require fairly frequent blood tests to check and make sure that he or she doesn't get into side effects from consuming the oral immunosuppression. Okay. Then over the past few years, this very, very important medication came about. It's actually an injection. This injection would help to reduce your skin's inflammatory cells so that the eczema gets much better control. Okay. So once you can have it every month, for example, and for a couple of months, and you can see the effect and titrate accordingly. So this is turns out to be a really, really effective way of controlling eczema, and it's usually used for children 6 years and above. But now we are slowly reducing the age, okay, such that even for babies 6 months and above, there's some off-label use for it at the moment in Singapore. Okay. But the thing about injections is there can be some pain, okay, and also it's very, very costly. Okay, so you ask yourself, right? Many parents do ask me, I mean, if I really do not want to touch any topical steroids at all because I'm so concerned about the side effects of topical steroids. Okay, so what if I leave the eczema untreated? Does it matter? Okay, it certainly does. Okay, because there can be skin complications, number one. So what are the skin complications? The first one would be impetigo. You can see on this photo, because of extensive scratching, so a bacteria from the skin can get into the skin. Bacteria from your fingernails can get into the skin, and this can result in a significant infection, which is very painful, and it causes a lot of blisters, a lot of wet discharge surrounding that area. Okay. So that's not ideal. In very extreme circumstances, the bacteria can even get into the bloodstream and can cause a serious infection. Okay, so this is another form of eczema called prurigo nodules. You can see very significant round, thick lesions. These are super, super itchy and they're very, very hard to treat. So if you don't treat them early, sometimes such complications can happen, and I don't think you want that. So the last photo is on the right is a very common scenario because the eczema is so untreated, it's left untreated for such a long duration. So the skin will become thicker and thicker and thicker, and it will become lichenified. So lichenified means that the skin looks like a tree bark. Okay, this is very difficult to get down with using just mild steroids. So usually we'll need a very potent, ultra potent steroids to bring it down, so that so that it looks nicer and it will be a lot less itchy. Okay, so if you don't treat eczema, the skin complication would be some of these. Okay, however, it's not just limited to skin in terms of complications. Okay, as you can see in this diagram about atopic march, if you have untreated childhood atopic dermatitis, there will be increase in exposure to external allergens, proteins from the environment, right? So this exposure can thus trigger your immune system to develop food allergy, which will then in turn trigger incidences of asthma and allergic rhinitis, which is sensitive nose, okay? So all these conditions, sensitive conditions, are related. If you don't treat one, then the rest can take place. So as you can see, the very first step of this sensitive, all these four sensitive conditions, the very first one that occurs would be classically eczema. And you can start off even from birth. And then from about 1.5 years old, food allergies can develop, okay? And sensitive nose can develop from about 3 years old onwards. And later on, asthma can develop, okay? So this is just a rough pictorial schema to just show you that one thing can lead to another if the first thing doesn't get controlled, okay? All right, so there are so many other complications, but let's just talk about psychology, okay? Since this talk is organized by Annabelle Kids Psychology. If your eczema is not treated well, your sleep quality is going to be really poor. This in turn leads to a poor quality of life. Okay, it can lead to daytime sleepiness, of course, and then your attention span in the daytime will be very poor, and this can result in poor academic grades. Because of your your body image being affected, and also the age itself, right? Many of these children can become depressed. They can also have anxiety disorders, and some of them can have attention deficit hyperactivity disorder. And this will just make them scratch even more, okay, sometimes. And in extreme circumstances, some of them can even be suicidal, okay? Okay, and I didn't add another extra slide, but there are some studies which associate a lack of a good optimal eczema control with osteoporosis, which is weakened bones, as well as malignancies or cancers like lymphoma. Okay, so I don't think it should be taken lightly. You can't just say that eczema is just a skin condition and we shouldn't care about it. Okay. So can my child swim? Yes, your child can swim, okay, but only when the eczema is well controlled and there is no infection going on, okay? So it's important for your child to lead as normal a life as possible. Also, do take note that try to avoid the time between 10 a.m. to maybe 4 p.m. because that's when the ultraviolet exposure will be the most immense. And sometimes UV exposure can trigger eczema itself. So try to avoid that timing, and try not to swim for too long, because if you swim, for example, beyond say 20 minutes, right, then the essential oils from your skin will leach out from your skin, and this can compromise your skin barrier. And after that, you would see that there could be an eczema flare thereafter. Okay, so that is the usual mechanism of why being in water for a long period of time, or rather swimming, can trigger eczema. Maybe not so much of chlorine allergy or anything like that. Okay, so should I bathe my child with soap? So I'm actually quite surprised that several parents don't bathe their kids with any form of cleansers, because they just feel that it does more harm to the child's eczema. So they just do like a very quick bath with just plain water. So, okay, so what is the correct answer? So you should not use, you should use a soap substitute, because if you use soap itself and if there's too much bubbles, right, the bubbles will again remove the oil from the skin. So you don't want that. So you need an oil substitute or a non-soap cleanser, okay? So there are different brands in the market which can cater to this need. You do need to use a cleanser, because if the bacteria stays on the skin, right, this results in infections when the child scratches excessively, and the bacteria itself can also trigger flares. Okay, therefore you need to remove all that bacteria by bathing once a day with lukewarm water, just for 5 minutes, and not in like a bathtub. Okay, so that the process is quick. Okay, so I just want to remind everyone that not every skin lesion equals to eczema. You can just, oh, it's just eczema. Okay, sometimes it could be something else. So just give you a flavor of what different rashes can look like. So these are some buttock rashes because it's pretty common in babies, right? So along the buttock area, yes, this is a diaper rash, of course, but you can see little red dots like that distinctly around the buttock area. This is because of candida infection, which is a type of yeast. If you see many ulcers around the buttock area, this could be because the diaper rash is so serious and wasn't attended to early enough. So most of this, a lot of the skin has eroded. So this needs to be addressed properly as well. If the rash only occurs at a certain part of the diaper area, then sometimes it may be due to allergy to the material that the diaper is made of. Okay, so this is called a contact dermatitis, and the area that has the most friction or most contact with the diaper will tend to get this rash. So if a baby has a rash around the face, most of the time, 90%, more than 90% of the time is because of eczema. However, if it looks a little bit odd or strange, it could be because of other reasons. Like in this case, this is because of zinc deficiency. So zinc is a mineral, and sometimes you can get zinc deficiency because the mother's breast milk does not get enough zinc. Okay, if the baby is actually totally breastfed. Okay, just to scare you a little bit, sometimes if rashes look a little bit odd like that, and then do see a doctor. In this case, it's actually a kind of blood disorder, okay, that results in this rash, okay? Okay, so what should I not do? Okay, as a caregiver of a child with eczema, first of all, don't scold your child when your child scratches, okay? Because they really can't help it, okay? So don't reprimand them excessively. Keep encouraging them, and treat the eczema. Bring them to a doctor. I think that's more important. Okay, don't take long baths. Okay, long showers in bathtubs. Okay, because the oil from the skin can be removed. Okay. Do not attempt to restrict food unnecessarily. So over my years of treating eczema patients, I've seen all kinds of scenarios, but the most extreme of which was when I saw a child being only fed a liquid diet of a special kind of herbal plant because a special kind of herbal plant because the parents are so worried that any kind of food would trigger the eczema. Okay, so so please don't do this unnecessarily. If you don't give your child enough nutrition from different food types and different food groups, right, that in itself can give rise to a lot of skin rashes that may resemble eczema in itself. Okay, and your child's growth will be severely affected. So don't over-restrict unnecessarily without supervision from your doctor. Okay, so please don't believe everything that you read on the internet because it's a double-edged sword. It's very good that everybody gets very well informed, but sometimes what's written may be not accurate. So they may not pass through rigorous a very rigorous scientific sieve to really make sure that whatever is there is truly accurate. Okay, so yeah, don't believe wholeheartedly everything that you read, no matter how convincing the argument seems. Okay, what should you do? You should always encourage your child to apply moisturizers frequently. You can also apply along with him so that if he sees you as a role model, maybe he or she may be more receptive towards the frequent application. Okay, when your child goes under the sun, do remember to apply sunscreen. Sun protection is important because, as I said before, UV exposure can trigger eczema as well. Okay, try to limit stress in your child's life, because stressing your child too much can also cause eczema flares. If the situation is so serious, right, despite optimal topical care, maybe it's not a bad idea to visit a psychologist as well, just to teach some distraction techniques. Okay. Okay, so I've come to the end of this FAQ session, and I hope I've tried to answer some of the frequently asked questions. There are some people who joined in late. If you have any frequently asked questions that you want me to answer, please go ahead and ask. Even you may have missed the front part of the talk, but I really don't mind answering them again, because this is my job. I answer these questions on a very, very regular basis. So I'm happy to answer if there's anything.
Yeah, thank you, Dr. Chong, for the informative presentation. So in the comments, there are actually some questions from the audience. The first one is from G. They say, I have both Elidel and Protopic and Cultivate and Elomet. Is there one that is more recommended and which is milder?
Okay, so first of all, I'll have to assess your child. Because if your child, for example, if your child has very, very thick lesions, like the tree bark looking thing, right, then Cultivate would be something that may be appropriate. Cultivate is something that is very, very strong. It's not something I would give usually, but if it's necessary, yes, it can be given, okay? So Cultivate and Elomet are both steroids, both strong steroids, and Elidel and Protopic belongs to topical calcineurin inhibitors, okay? So I would say that both are fine, okay? Because honestly, anecdotally, topical steroids work faster, okay, compared to topical calcineurin inhibitors. So I would prefer that the child seeks relief faster. After that, if you are concerned about steroid use, we can always switch over to topical calcineurin inhibitors quite shortly after, okay? So my answer in general is, I think, yeah, you have to see the situation. Which is milder? Okay, so I would say Elidel and Protopic may not be, in terms of, like, if you compare side by side, right, probably not as strong as Cultivate and Elomet. Yeah. Okay, can you, okay, next question. Can you comment on topical steroid withdrawal? Okay, so this term, right, topical steroid withdrawal syndrome, yes, I've seen it, and yes, there are one or two publications about it, okay, but all those publications so far, right, they are just describing what they read in the internet, okay? So today, actually, there's no real, like, how to say, scientific study to really explore this in very, very great detail, okay? So being a very open person, I wouldn't say 100% that there isn't any veracity to this, okay? But sometimes if you take things to the other extreme end and don't touch topical steroids at all, then your child may suffer from eczema for a longer period of time. Yeah, so as with anything, you should always take everything in moderation, okay? For example, with paracetamol, okay, it's used to treat fever, right? If you take too much of it, you can result in overdose as well. So same for topical steroids, you need to titrate and moderate it and use it appropriately under supervision with a doctor, okay? So yeah, so that's what I want to say about topical steroid withdrawal. Okay, next question. Are there particular seasons that make eczema worse? Is it winter or summer? Is it to be a drier climate or humid? So this is an excellent question. So it really depends on your child's skin. Okay, so so eczema is just a blanket term that we use for this condition, right? But actually every child needs to have a tailored regimen, okay? And every child is different, okay? So some children, they thrive in the cooler climates, okay? But it's a double-edged sword. If you are in a very, very cool climate, sometimes the skin will become very, very dry, and that can trigger eczema as well. However, if you are in a very, for some patients, if they are in a tropical climate like in Singapore, the sweat can really, really worsen things, okay? So, so it really depends. So if it's in the winter season, it can be, although there's less sweat, but it can be too drying. But then in a humid region, yeah, it's less drying. However, if it's too hot and you sweat too much, the sweat also can trigger eczema. So it's all about a balance and moderation again, and it depends from person to person. Yeah. Does alkaline water help eczema patients? No scientific, no real scientific basis at the moment. Okay, I mean there are many different things and different even food substances which are supposed to be helpful. Okay, if it's not harmful to your child, I don't mind you trying a little bit at a time to see if it helps. Okay, but if you try out, it doesn't help, then it doesn't. Okay, yeah, that's all I can say. Yeah, just to be a bit open sometimes. Okay, what are the common okay, so it's a combination. Okay, what are the common causes of eczema? Are the causes more genetic or environmental? I would say that it was actually a combination of both. It's genetic from the outset, and then environmental triggers will cause the eczema flares. If I didn't answer these questions to your satisfaction, you can unmute yourself and ask me directly. I just want this to be a chat because I just want to be more interactive if possible.
If anyone has any other questions and are a bit too shy to unmute yourself, you can just type it out right now. Otherwise, maybe Dr. Chong could go through some of the things that you mentioned earlier in the chat, because some of the participants actually joined a bit later. Things like what kind of food the children should avoid.
Okay, sure. Okay, so one more question. Any advice for my kid with eczema going into to full-time childcare? My child sweats a lot. It's a very common problem, Yeah, so it's not easy. It may not be easy. Okay. Okay. So when your child starts going to childcare, first of all, he's going to get, okay, touch wood, I hope it won't happen, but most of the time, okay, most children, when they first go into childcare, there's this initiation period, which can even last for many months. They can fall sick very frequently, okay, with or without fever. So cough, cold, vomiting, diarrhea, all that, okay. Unfortunately, all these viruses can trigger eczema in itself, okay. Additionally, your child will also be playing with a lot of children, sweating a lot and going under the sun, maybe more often than previously, okay. Yes, so all that can trigger your child's eczema, okay? So so you need to, I would say it's very difficult. If you don't want your child to have so many eczema flares, of course you don't let your child go into, don't enroll your child to childcare, but I firmly feel that I want your child to be as normal as possible, to have a normal quality of life and learn the things they're supposed to learn in school, okay, be it social or academic, etc. So it's a phase that all eczema patients do have to go through. However, if you catch the eczema fast enough and early enough and treat it well right from the beginning, then you should not be having a problem, okay? So you should see a doctor to basically give you the weapons to treat the eczema as soon as possible, okay? Yeah, so good question, and you can expect that it will get worse, okay? And don't be disheartened or disappointed that it happens, because it's just natural and you cannot keep your child at home forever, okay? Next question, can eczema be totally cured, or is it something that is lifelong and needs regular treatment? Okay, so there is no cure for eczema, unfortunately, but there is control. And I've seen that if you control your child very well in the ways that I spoke to you about over the past hour, then the earlier you control it very well, moisturizing frequently and treating every flare immediately and very quickly and effectively, then the chances of your child growing out of it earlier would be faster. Growing out of it doesn't mean that it's 100% cure, but it just means that there is much better control. On and off, however, you must expect that there could be some flares here and there. And don't be so disappointed, okay? Because out of many terrible things to have, this one, at least there's some way to control it pretty well. Okay, so in case, just for the benefit of those who joined late, I just want to say, okay, talk about food again, okay, because that's the most frequently asked question. So what food should I avoid? Okay, so I would say, instead of looking at food per se, why don't you look at all the other things aside from food? Okay, I'll explain why. All right. So in our local context, so heat, sweat, falling sick with viruses and all that. That's the most frequent trigger for eczema flares. Okay, so so instead of looking at food per se and depriving your child of all the good nutrients to help him grow, please look at other factors as well, especially like house dust mites as well. Okay, so you can change the pillowcases once a week. Make sure that it's washed in hot water or sun it so that the dust mite load will be reduced. Okay, so environmental factors are equally or even more important than food. So the link between food allergy and eczema itself is really not very well studied. Okay, so as I said, as long as the food allergy is not the immediate kind of food allergy, the type where if you take the food, right, let's say you take eggs, immediately you get swollen eyes, shortness of breath, or hives, right? Then if it's not so life-threatening, don't be over worried about letting your child have the food, because it's even better sometimes because your body can gradually get used to that food if it's a delayed allergy. So in the US, they actually recommend early introduction of eggs and peanuts to children so that your body can get sensitized to it. Okay, so that's a conceptual thing which, if you find it a little bit hard to digest or understand, you can look for me. Okay. So is there any other FAQ which yeah, so this food thing is the most frequently asked question. Okay, but so despite everything that I've said, some parents would still be very concerned about food allergy itself. So in which case then, yes, I'll offer a skin prick test to just reassure them that at least there's no immediate food allergy. Okay, we can get that out of the way with a very simple skin prick test, which is not painful. You can get the answer in 20 minutes. The only caveat is that you cannot take any oral medication for 1 week before the skin prick test. It's quite easily done. Okay.
If there are no further questions, yeah, thank you so much, Dr. Chong, for taking your time out on this Sunday morning.
No problem at all.
Some of the anxieties that both parents and children must feel about eczema.
Yeah, no problem. So if there's anything, the contact is on the screen. So if there's anything, you can ask me. Okay, that's all. Thank you very much.